My name is Piers Connolly. I am a financial services director. I've worked in the industry in London across a number of investment banks for the last 25 years. Before I really put my hand up to say that I had a mental health issue was a difficult place to be. I worked extremely hard. I was ambitious and was trying to make sure that my profile and my personal brand, if you like, within the organisation was, in my view, the best that it could possibly be. So that resulted in me doing a lot of hours, but over a period of 4 or 5 years of doing that, I found myself to be anxious, and I had an overinflated sense of responsibility to the organisation. The boundaries between my work and home life became incredibly blurred. I would be in a scenario where I would think that I'd made a decision. My mind would immediately calculate 4 or 5 different scenarios, i.e. the outcome of that particular decision. I would pick the worst scenario possible, and that is the one that would come to pass. So having made a decision, being in that situation, I then got on a plane on a business trip and ended up unable to unravel, if you like, the decision that I had made. It was going round and round in my mind to such a degree that actually I didn't sleep for a couple of days at all. I didn't eat very much because I felt so worried and anxious about that particular decision. I was unable to move on from it. And unfortunately, it got so bad at the end of that trip, looking over the balcony in the hotel in Frankfurt, that I thought that might be a way out of this very, very difficult situation. Thankfully, I realised that those thoughts were clearly very much a big problem, and that needed to be dealt with. So that was certainly a big moment in my life, and actually I suspect the starting moment of my recovery. Speaking up was actually, for myself, I felt fairly comfortable with doing that. I think probably because I realised that there were some very serious health issues going on and I needed to do something about that. My immediate managers were very surprised when I said to them that I'd been to see doctors and occupational health, and actually I ended up being signed off from work for 4 months. In personal life, I am very lucky. I have a hugely supportive partner and family, and actually she had noticed changes in my behaviour, not just about work but also at home, over a number of months. I think she was more than anything delighted that I'd actually realised that there was a problem and I needed to do something about it. I would encourage anybody to talk about a mental health issue they may be suffering from. It's okay not to be okay. Putting my hand up to say that I was not okay and that I needed some help has been something that I've been so pleased that I have done. Ultimately, I would say that having been through this process, having said that I was not okay, having learnt some techniques to deal with the way that I was working and I was thinking, I am a much more effective individual in the workplace now than I was before. And also for me, what's important is that I'm definitely, in my view, a more effective husband and father. If you really feel that you may have a problem, the way to deal with that is to put your hand up and ask for help. It's not a weakness, it's a strength in my view, and it's something that everybody should feel comfortable doing. Organisations need to move into a more of a preventative state when it comes to mental well-being. We need to make sure that people have the necessary training and education, and managers in particular are trained to ensure that an environment is created where people feel able to talk about those particular issues. The manager is equipped to be able to give guidance and help, and also for that manager to recognise some of the signs so that we're able to get to people before they get to the position that I was in. I've changed certainly the way that I operate at work and at home as a result of this incident. I created my own personal anagram, if you like, of the things that I do, and it's called Piers' Palette. The P stands for perspective. I stands for insight. This is me trying to understand the way that I was behaving in certain situations. E is for exercise. It could be the gym, it could be going for a walk, it could be playing some tennis, it could be ballroom dancing. R stands for rest, which is really just to give yourself a break. So at weekends I do different things. I play golf really badly. I attempt to play cricket, doesn't always go so well. S is probably the most crucial one for me, I think. I have to make sure that I get enough sleep. If I don't, I'm definitely not very good from a mental perspective. So just some small things can make a big difference. So the CISI mental health portal is a tremendous source of information around mental health for both the individual and an organisation. It's very easy to use, and the information on there is extremely helpful and could help you make some changes in your own life or for your organisation to make some changes that would allow your people and your organisation to be a mentally healthy place.